8:14, time to talk to Dr. Brent Wallis, Dr. B, Chief Medical Officer over at People's Health. How are you, Dr. B?
Hey, Tommy, I'm doing good. How about you?
I'm okay. Ready for Thanksgiving? You?
Yeah, just about. I did some shopping yesterday.
All right. A lot of older adults are living on fixed incomes, looking to save money on their health care costs. Medicare Savings Programs and the Extra Help Program are designed to do just that. Dr. B is going to help us navigate our way through it. And it's some valuable listening for either you or your parents. I guess, Doc, the first thing we need to do is explain the difference between Medicare and Medicaid.
Yeah, sure. So Medicare is the health insurance program that's funded by the federal government. And it actually offers health care benefits to anybody who's age 65 or older, but then it can also cover people that are younger than 65 if they have certain types of medical disabilities. And then it can cover any age group if you have end-stage kidney disease. And then Medicaid is a joint federal and state program that really helps to pay for the cost of care for people with limited income and resources. And the eligibility for Medicaid is going to vary from state to state.
Can you have both Medicare and Medicaid?
You can, definitely. So Medicare and Medicaid are two separate programs, but they can definitely work together to help cover your health care cost and maybe defer costs from one program to the other. So Medicaid helps pay for services that are covered under original Medicare, like things like going into a hospital or a skilled nursing facility, so you don't have as high an out-of-pocket expense that you would just under Medicare. And then Medicaid can also pay for services that are not necessarily covered under original Medicare, so things like routine vision care or even prescription drug coverage.
What are some other services that are covered by Medicaid?
So since Medicaid is a state program, each state is going to have its ability to decide what it's going to cover and what it's not going to cover. But there is a bar that is set. So all states are required to cover certain health benefits, things like doctor's visits and going to the lab and getting inpatient hospital care. And then each state gets to pick what extra services they do. So here in Louisiana, we have several extra services, things like chemotherapy for cancer treatment and a lot of types of durable medical equipment or equipment you may need in your home to care for yourself.
And there are ways that people can save on their Medicare cost, right?
Yeah, there are, and you really want to think about these because the cost can get pretty high if you have certain medical conditions, and so people with limited income or resources might be eligible to enroll in what's called a Medicare Savings Program. And those programs, even though they're Medicare savings programs, they're actually managed by Medicaid. And what they do is they help to cover your Medicare premiums as well as any of those cost sharing or deductibles or co-insurance. So all of those co-pays that you have to pay under Medicare, some of that can be deferred under this Medicare savings program.
Who's eligible for a Medicare savings program?
So there's really four different types of savings programs, and each of them are slightly different. They have different benefits and different eligibility requirements, so it can get a little bit confusing. So kind of the baseline is to enroll in any of the savings programs, you have to have Medicare Part A, so you've got to be eligible for Medicare Part A, and you do have to meet some income guidelines. And those guidelines are going to vary a little bit. They're based on how many people are in your household. They're based on the federal poverty levels. And keep in mind that changes from year to year. So you may be eligible in one year and not in the next, or vice versa. So that eligibility can change from time to time. And like I said, it can get confusing. You really can find more information at the Medicaid website, the Louisiana Medicaid website, which is medicaid.la.gov.
Let's get into the different kind of savings programs that they have, and then we'll take a break. We'll come back, talk about how you apply for them. So what are the different savings programs?
Yeah, so the first one is something we call a Qualified Medicare Beneficiary Program, or QMB for short. And that program actually pays the premiums that you would otherwise pay, and it also covers any deductibles or cost sharing that you would have under Medicare's Part A or B. And then the next level is what we call a Specified Low-Income Medicare Beneficiary Program. That one is SLIMB. and that actually just helps to pay for your Medicare Part B premium, but doesn't kick in extra dollars for those deductibles and cost sharing. And then the third program is called a Qualifying Individuals Program, or just QI. That actually also can kick in some money to help with your Part B premium cost. And then the last one is called a Qualified Disabled Working Individual Program. So what that's going to do is it's going to help pay your Medicare Part A premiums as well.
Quimby, Slimby, QI, and is it Quidwy? What are we calling that fourth one?
Quidwy, yeah, I can't really pronounce that one, so it's a little harder.
It's like reading an eye chart. And if your eyes are glazing over, Dr. B will get you through all of this, and you can always go to medicaid.la.gov to find out more. And we'll talk about who can apply for Quimby, Slimby, QI, or Quidwy when we come back. Dr. B, Chief Medical Officer over at People's Health, trying to save you a little bit of money or your parents on health care costs. And, boy, we all can do with saving some money. 8:20 now, traffic, WWL. 8:24 and a half, Tommy Tucker, WWL, back with Dr. Brent Wallis. Dr. B, Chief Medical Officer over at People's Health. A lot of older adults living on fixed incomes looking to save money on their health care costs, and Medicare Savings Programs and Extra Help Program are designed to help them do just that. So, Doc, we've already talked about the different savings programs, Quimby, Slimby, QI, and Quiddy. How do you apply for these?
Yeah, so this is really the important part, and you don't have to worry as much about all the various programs because if you reach out, they'll check and see which one you might be eligible for. So this is when you want to pull out your pencil and paper, and there's a few different ways you can apply. You can actually go in person to your local Medicaid offices, and all of those are listed online at medicare.la.gov. And on that website, there's also a place where you can apply online. And then if you prefer to call somebody on the phone, you can actually call Louisiana Medicaid directly. Their number's on the website, but it's 888-342-6207. They're going to explain all of these, get some information from you, and actually see if you qualify. And it can save you a really tremendous amount of money.
What about programs to help pay for prescription drug costs?
Yeah, these are very important as well. I mean, everybody knows how much prescription drugs can cost. So there is a program called Medicare's Extra Help Program, and it is separate and distinct from the Medicare Savings Programs. So what that does is it actually helps to pay those out-of-pocket prescription drug costs. It may even help pay your Part D or prescription drug premiums and deductibles, but it's really going to lower some of those copays. And it, too, is dependent on your income, and so you may qualify for either full extra help or partial extra help. And even partial extra help can really help reduce the cost of those medications. So, again, a really important program to look into.
Who is eligible for extra help?
So what's good about extra help is a lot of people automatically qualify for it. So people who have either full Medicaid coverage or if they get supplemental security income benefits, or if you're already enrolled in one of the Medicare Savings Programs we were talking about, the ones that actually pay for your Part B premium, you'll get automatically enrolled in the Extra Help Program. And what you want to look for is you're going to look for a letter that's mailed to you from Medicare, and it's actually always purple. So if you see, if you see a purple letter in your mailbox, don't throw it away. You want to open it up because it's going to tell you that you're eligible.
Go Tigers, right?
Mm-hmm.
What if you don't automatically qualify?
Yeah, and sometimes either the government may not have the correct information. You may just not automatically qualify, so you still want to check. And the best place you can go to learn about the eligibility and check those income requirements is medicare.gov/extrahelp. And a lot of people, like I said, don't know that they qualify for it, so there's a chance you may still be eligible, and you want to go ahead and apply. Extra Help can actually save you estimated probably a little over $5,000 per year. And so it's a really significant program that can help put a little bit more money in your pocket.
That'll help you stuff your turkey. How do you apply?
Yeah, so like with the Medicare Savings Programs, there's several ways to apply. You can go to your local Social Security office and apply, or you can call the Social Security Administration, and that number is 800-772-1213, and they'll help you with everything you need to do.
And the People's Health Center will help with this, right?
Yeah, absolutely. We've got all this information and more. We can provide you all that contact info and help you kind of determine if you may be eligible for these things. So definitely come see us. You know, we're hosting a lot of in-person benefits presentations here in New Orleans, but really across Louisiana. We've got all those listed on our website at peopleshealth.com/meetings. And you can definitely come visit us over at the People's Health Medicare Center in Metairie, right next to Party City.
3017 vets, appointments recommended, but you can walk in, right?
Yeah, absolutely. Come in and see us. We've got snacks, we've got coffee and tea, and we can actually just sit down with you and have a discussion about Medicare. It's very confusing, and this is an important time of year. It's also open enrollment right now, and so, you know, you've got about 3 weeks left before that annual enrollment period closes on December 7th, so it's a great time to come by and just chat with us.
And you did a great job, and there's a lot to cover without sitting down and talking to somebody about it face-to-face, writing things down, looking, et cetera. So that's why, really, it would be a good thing to go to the People's Health Center or to make an appointment. You can go to peopleshealth.com or call 1-800-978-9765. Some good information, Dr. B. Thank you. I appreciate your time. I hope you all have a great night. I think I'm going to talk to you before Thanksgiving, right?
Yeah, I think we're going to talk on Tuesday, so I'll talk to you then.
Have a great weekend before Thanksgiving.
Thanks, Tommy. You too.
Look for the purple letter and go Tigers. All right, you can go to peopleshealth.com, find out more. Call 1-800-978-9765, 8:30. We'll talk about